friends, this is my head to toe video for advanced health assessment. So when we begin our assessment, we come in, introduce ourselves to the patient. Hi, I'm Brianna, I'm a graduate nurse student. I'm going to perform your head to toe assessment today. We'll perform hand hygiene, don gloves. We're going to check the client's vital signs, get her height and weight, and then begin the exam. First, we're going to inspect her head. We're going to look for symmetry, look for anything abnormal, look at her face, her skin color. Then we're going to palpate. We're going to feel the head for anything abnormal. We're going to feel her hair. It's evenly distributed. It's not too thin, not too thick or brittle. Then we're going to palpate the frontal sinuses, the maxillary sinuses, and then the temporomandibular joint. So open and close your mouth, please. Okay. And then we're going to inspect the nose. We're going to check her turbinates. We're going to check the septum, and we're going to look at the mucosa. So everything is pink and moist. The septum is midline. And then we're going to check the patency of the NURS. So we're going to close this side, if you will, blow out. And then we're going to do this side, blow out, please. Both of them are patent. And then we're going to look into the mouth. We're going to check her lips, her gums, her mucosa, her teeth, the roof and the floor of her mouth. So if you open your mouth, please. We'll just look at the tongue, look at the roof of the mouth. If you'll lift your tongue for me, look at the floor. All right, stick your tongue out for me. All right, we're just gonna look at the cheeks, look at all of her teeth, make sure everything's intact. Everything is pink and moist. And then we're going to look at her eyeballs. So we're just gonna look, inspect the eyebrows, look at the eyes, look at the conjunctiva. Everything's pink, moist. Look at me, please. My eyes are even. We'll do the light reflect test. So when I shine the light in the bridge of her nose, you'll look straight ahead at me, please. We can see the light reflected in the same point in each eye. And then we'll perform the cover test. So if you will, cover your right eye for me and look right at me. All right, and then cover your left eye. All right. If there's anything abnormal when she covers her eye, the other one would fixate itself, but both of her eyes are fine. And then we'll perform the ophthalmic scope exam. We would dim the lights, but for the video, we're not going to. So, first, we will look for the red reflex in each eye. Okay. And then we're going to look for the fundus, look at the macula, look at the blood vessels. We will check both eyes. So you use your right eye, your right hand to look at her right eye. And then the same for the left. You use your left hand to look at her left eye. All right, and everything looks good for her. And then we're going to inspect her ears. Just look, see if they're even, see if they're the same height, which they are. And then we're going to palpate. Feel for any tenderness, anything abnormal. Does this hurt? All right. And then we'll just look into her ear. Right, and we're looking at her tympanic membrane. It's pearly and gray. And then we'll check the other side. Pearly and gray, no redness, and it's not fluid filled. And then we will check for lateralization and one straight this, put buzzing on top of your head. You'll let me know if you hear it in one ear or both ears.
Both ears.
All right. And then we'll check her bone and air conduction. So I'm going to strike this, put it behind your ear. You'll let me know when you can no longer hear it. And then I'll put it in front of your ear, and you'll let me know when you can no longer hear it. And then we'll time it.
And it stopped. It stopped.
Next, we're going to assess the cranial nerves. We'll begin with cranial nerve 1, which is the olfactory nerve, and we'll perform the smell test. So, if you will, tell me what you smell.
Alcohol.
And then on this side. All right. Then we'll perform cranial nerve number 2 and check her visual acuity. If you will cover your right eye for me, and then let me know if you can see anything. All right. And then from this side too. Okay, cover your left eye. And the same thing. Yes. Okay. Then we'll do cranial nerve 2 and 3, and we're going to check her pupil responses. So we'll check for light and accommodation. So if you will. And when we shine the light in one eye, the other one should constrict and then dilate as well. And then if you'll look here at my nose, and then look back here behind me, and then back at me. You see that her eyes constrict and dilate, and that's accommodation. And then we'll check her extraocular movements, which is 3, 4, and 6. So if you'll look here at my finger, and just follow it with your eyes and not your face. Okay. And then we'll check cranial nerve number 5. We'll get her to clench her teeth. I'm going to feel while she does it and then relax. Okay, and that's her trigeminal nerve. And then we're going to check cranial nerve 7, which is the facial. We'll get you to smile, frown, and puff out your cheeks. And then we'll check cranial number 8, which we already did doing the Renee and the Weber test. And then we can do the whisper test. I'm going to stand behind you, and you just repeat what you hear.
Go Tigers.
Alright. And then we'll check cranial nerve 9 and 10, and we're going to do the gag reflex. If you will, stick your tongue out and say ah. And then watch how you will move up and down. And then we'll check cranial nerve 11, which is the spinal accessory. If you will, for me, shrug your shoulders. Right, and then move your head around, all the way around. And we'll do cranial nerve 12. If you will, stick your tongue out for me. Move it side to side, up and down. All right. Next, we're going to assess her neck. So first, we'll inspect it. Look for symmetry. Look at the color. See if we see anything abnormal, such as bruises, cuts. If we see any swelling, anything of that nature, then we'll assess her range of motion. If you will, roll your neck around for me, please. Turn your head side to side. Alright, and then we will palpate her lymph nodes. So we'll start with the occipital, the post-auricular, the pre-auricular, the parotid, the temporal, the submandibular, the submental, the anterior cervical, the posterior cervical, and the supraclavicular. Nothing is swollen. And then we're going to palpate and auscultate her carotid artery. So we'll feel on this side. Alright, good. 2+ pulse. And then we'll auscultate for any bruise. Alright, and then we're going to inspect her trachea. We're going to look, see if it looks deviated. And then we'll palpate, and if you'll swallow for me, please. Okay, everything's midline. And then as we're looking, we'll check the thyroid to see if we see a goiter or anything like that, but she does not have one. And then we'll come behind patient and we'll check, see if we can palpate the thyroid. If you will, swallow for me. And you can give your client something to drink, like a sip of water, if that'll help. Okay, and swallow for me. And we're just feeling to see if anything's enlarged, and it's not. And then we're going to look at her jugular vein, see if we see any distension, any pulsations. All right, and then if you lay back for me. All right. And then we'll look as she's lying down and see if we see any distension or pulsations. Next, we're going to inspect the posterior thorax. So we'll inspect, we'll look at her skin, watch her breathing, see if we know anything abnormal. We'll look for scars, cuts, bruising, see if we see any masses, anything like that. And we're watching her breathing, looking for symmetry. And then we're just going to palpate, see if she has any tenderness back here. Do you have any tenderness?
No.
Okay, and then we're going to assess her respiratory expansion. So I'll put my hands back here under the 10th rib and ask her to take a deep breath in. And we're checking for symmetry when she breathes in and when she breathes out. And then we're going to assess tactile frenitis. So if you will say 99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99.
99.
All right, and we're feeling for the vibrations as she's speaking. And then we would percuss the diaphragmatic excursion. So we'll take our reflex hammer while we percuss. And we're going to get her to take a deep breath in and hold it. And we're just going to percuss until we hear an area of dullness. And we'll mark that off. And then we'll get her to exhale and hold it as long as she can. And then we'll percuss again till we hear dullness. And we'll mark that. And then we'll get a ruler. And we'll measure our markings. And normal is about 3 to 5 centimeters. And hers is 4.5. And then we're going to also take her breath sounds. So if you will, just take some deep breaths for me. And we're just listening to hear if we hear any adventitious sounds. Okay, and then we're going to test for CVA tenderness. All right, when I strike you, let me know if you have any pain. Any pain? How about that? All right. Now we will inspect the anterior thorax and chest. So we're going to inspect, look at the skin color, watch her while she's breathing, look for symmetry, look for anything abnormal such as cuts, bruising, any masses, see if we feel any thrills or pulsations. And then we will palpate. See if we feel anything abnormal. See if we feel any thrills, any pulsations. And then we palpate her apical pulse. And then we're going to assess the tactile frenitis. So once again, if you'll say 99,
99,
99,
99,
99,
99,
99.
99.
And then we will percuss. And then we can also take her breath sounds. And then we will auscultate her heart sounds. So first we will do it with the diaphragm. So we'll do the aortic, the pulmonic, Erb's point, the tricuspid, and the mitral. which is also the apical. Alright, so we did it with the diaphragm, now we'll do it with the bell. Then we'll go to the aortic, the pulmonic, Erb's point, do tricuspid, and the mitral. And then we're going to get her to lie down and we'll listen one more time. So first we'll listen with the diaphragm, then the bell, aortic, the pulmonic, Erb's point, tricuspid, and the mitral. And then while she's lying down, we can feel the apical pulse again. And we can also observe and look for it and see any pulsations, anything like that. We'll see it pulsing. And then we will assess her pulses. So we'll do her radial, check her brachial, and then her femoral down here, and the carotid. And then we'll check the other side. Do the radial, the brachial, the femoral, and the carotid up here. Okay. Next we're going to assess the abdominal area. So for comfort, we would just expose the abdominal area. So we'll cover her legs, cover her chest, and then we're just going to inspect her abdomen. We're going to look at the skin, look at the color of it, look at the shape of it. Is it convex, concave? Look at her skin color, see if we see any striae, stretch marks, discoloration, any cuts, bruises, anything abnormal. We're going to look for pulsations and peristalsis, so you can get eye level. And then we'll auscultate the abdominal quadrants. Alright, so we're just listening for active bowel sounds. And sometimes you might have to auscultate for up to 5 minutes in each quadrant before you hear something. So, and then you'll determine if they're regular active, hyperactive, or hypoactive. Oh, excuse me. And then we're going to listen for bruits as well. We're going to listen to her renal arteries, her iliac arteries, and her femoral arteries. So we'll use the bell of the stethoscope. Then we'll listen. So listen to the renal arteries. And I'll listen to the iliac. And then we'll listen to the femoral. And then we'll palpate her inguinal nodes for any swelling or tenderness. Okay. And then we're going to percuss the 4 quadrants of the abdomen. And then we'll come over to the right side and we'll percuss for the liver span. So we're going to do it in the mid-clavicular line, and we'll start down here, kind of lower, and then we'll work our way up until we hear dullness. And that's going to, if you're going to mark it, and that's going to be the bottom of your liver, and then you'll keep going until the sound changes again. And that'll be the top. And then you'll measure, and normal is going to be less than 12 centimeters. And then we can get her to take a deep breath in, and we'll feel, see if we can feel the liver, see if it's swollen. And then we're going to test her abdominal reflexes. So what we'll do is we'll just swipe and look for those reflexes. And then we're going to palpate for the spleen and the kidneys and the aorta. So we palpated for the liver, and then we're going to take a deep breath in and feel for the spleen right here. All right. And we don't feel her kidneys, her bladder's not distended, and feeling right here for her aorta, and I don't feel any pulsations or anything sticking out. Now we're going to do her arms, shoulders, elbows, and hands. So if you will just hold your hands up, your arms out, and we're just going to inspect. So we're just going to look at the skin color, look at muscle mass, and so we'll kind of rotate your arms. So we're looking for anything abnormal, any discoloration. All right, and then we're going to look at her shoulders. All right, we'll palpate her shoulders, feel them, and then just move your arms like this. Check her range of motion of her shoulders. All right, that's good. Bring your arms down and we'll palpate her elbows. All right, nothing abnormal. All right, can you move your arms like this? All right, checking range of motion of the elbows. And then we'll look at her hands and her fingers. Look at the color. See if anything's abnormal. And then we'll palpate, feel the temperature, feel the skin, check her cat refill. Should be less than 3 seconds. And then we'll get her to move her fingers. All right, can you rotate your wrists? All right. And then we're going to check stereognosis. So I'll get her to hold some objects in her hand, have her tell me what it is. All right, if you'll hold out your left hand for me. All right, and close your eyes. I'm going to place an object in your hand. Can you tell me what that is?
Feels like a coin.
It is, okay. And then hold out your right hand for me. All right. And then can you tell me what that item is?
Feels like a clip. A little paper clip. Or a... safety pin.
All right. And then we'll check for a pain touch and a soft touch, okay? So this is soft and this is pain, okay? All right, so if you'll close your eyes for me and tell me what you feel.
Soft. Pain. Soft. Pain. Soft. Soft.
All right. And then we're going to check our coordination. So if you will, touch your finger to your nose and alternate hands. And do it kind of fast. Faster. We will also test for strength when we're doing the arms and the hands. So if you'll hold your arms up for me. All right, if you'll push up against mine. Okay. And then if you'll flip your hands over and push down for me. Okay. And then we'll test your grit. And if you'll squeeze the right hand and the left. And now at the same time. All right. So next we're going to inspect her legs. So we'll look at the color of her legs, look for muscle mass, hair distribution, see if we see anything abnormal. And then we'll check the range of motion of her hips. So if you'll just kind of pick your legs up. All right. And then hold your leg out and the other. All right. And then we're going to inspect her knees. We'll palpate them. You have any tenderness, anything like that? Pick your leg up for me and kind of swing it out. Okay. And then we'll do the other. Any tenderness on this one? Okay, pick it up and swing it out. Okay. And then we'll look at her feet and her ankles. We'll inspect. And then we'll palpate. All right, any tenderness, anything like that?
No.
Toes are intact. And while we're palpating, we can go ahead and feel her dorsalis pedis pulse. We'll check on both sides, make sure they're bilateral and even. All right, and then if you will, just kind of rotate your foot. So we'll check range of motion of the ankles and wiggle your toes. All right, wiggle your other toes. Okay. And then we can palpate the popliteal pulses, and then the post-tibial pulses, and we've already done her femoral pulses. And then we'll do the cat refill on her toes, checking for good circulation. And then we'll assess her muscle strength. So sit back down for me right there. Alright, so if you will, try to push against my hands. Alright, now pull back and lift up with your legs. Okay, and then try and pull down. Okay, and then let's do your feet as well. Push against my hands. Alright, and try to pull up. Alright, then if you'll stand up for me. Alright, and we're just want to watch you walk. So if you'll walk to me and then walk back. Alright, so we checked her gait. Lastly, we'll assess her spine. So, just going to lift up her shirt. Okay, we're going to look at her spine. We're going to have her standing straight up at first, see if we see any curvature or anything abnormal. And then we'll get her to bend over and look at the spine. And then we'll just palpate it. Alright, and then she's bending down. So, we'll just assess her range of motion. All right, stand back up for me and can you twist side to side? All right, and then we're going to perform the romper test. So if you'll just hold your arms out for me, and we're checking her balance. And then if you'll close your eyes. All right, balance, she's steady. And then lastly, we'll check her gait once more. All right, if you'll walk to me. All right, and then if you'll walk heel to toe back to the bed. And then one more time, walk towards me on your tiptoes. All right, and then back to the bed. Assessing a female patient, we can also, we would do a breast exam, but for video purposes, we're not going to do that. But you would have your patient sitting on the bed. You would assess the breast, just inspect, look for the color of the breast, the contour, the shape, see if you see any dimpling, any discharge, anything like that from the breast. Then you can have her put her hands on her hip and then have her pull her hands up and just watch the breast move, and they should be symmetric. And then you'll have her lie down and put one hand over her head, and you will palpate using the vertical stripe method. Do light and deep palpation, looking for any masses, any tenderness, anything like that. If you were to find a mass, you would document it using the clock method. And then you can teach your patient about doing self-breast exams. Also, for our female patient, we can do the vaginal exam, which we're not going to do either, but you would use the speculum, check the cervix, and then do a bimanual exam and feel the pelvic area for any masses, any tenderness, feel the ovary.